and welcome back to the Community Game Plan. I'm one of your hosts today. My name's Eric Holman. It's early morning, so bear with me right now.
I'm Jim Smartin. I'm with him.
So today, as we venture back into the studio, it's really great to be here. But today, this is going to be episode 18 of the Community Game Plan. And today we sat down with Jan Rose. Jan is a Dartmouth-based pharmacist and dedicated Rotarian. Today we're going to explore the incredible impact of the international medical missions and the community-driven healthcare incentives that Jan and many people around us in our local community are focused on. So since
CACHA is this one, yeah.
Yeah. So in 2000, since 2000. Since 2019, Jan has participated in 5 medical missions with the Canada African Community Health Alliance, or CACHA. CACHA. We'll go by that from now on. So most recently, she's serving as a co-leader. Her work has taken her to Tanzania, where she and her team provide essential healthcare services to help underserved rural communities in East Africa.
This is why I give you the majority of the intros, all these big words, and I'm just like, it's just like, yeah, let's let Eric deal with these words while I can sit back and be like, that doesn't sound right.
I'm the worst, name pronunciator. I should not have been given this role, but either way, we're going to continue.
I like it. It works for me.
That was really interesting. I've sat down with Jan before. I mean, you've sat with Jan many times.
Yep.
So it was pretty interesting to hear what she does and the missions that they do and the impact. It's pretty amazing.
It was funny. She came originally when I first heard about her and the mission. She came to the Rotary Club to just do hey, this is what we're looking for, kind of a pitch. And I was just like, I reached out to her after. I'm like, so is this just for medical professionals?
Yeah.
Because this sounds awesome. I'm like, I can't do it. In my life right now, I'm not at the point where I can just say, hey, throw my daughter in a plane with us and I'll go down to Africa. It's not going to happen.
No.
But I'm just like, it is something that interests me, but I'm sure it interests other people too. Would you like to have a talk about this? And she was just like, oh yeah. She's it is far from just medical.
Yeah, and that's what we learned. I mean, there's the medical side of CACHA, but they also had the infrastructure, which she wasn't a part of. But CACHA, she mentioned, does missions for helping rebuild hospitals, or not even rebuild, but necessarily wells and all that type of stuff.
You're saying painting, anything really. But even with the ones that are medical, it has the people who need to do the paperwork to keep tabs on what's gone where. Yeah. These are non-medical volunteers.
Yeah. And it was pretty interesting too, the logistics aspect. It was great that she mentioned that they have a local Rotary in East Africa there, that they would help them as well, with the culture and everything like that. But we'll let her explain more of that in the interview up next.
100%.
So up next, we're going to have Jan. So we hope you enjoy our conversation with Jan and learning more about local Rotary and the CACHA program. We'll make sure we have show notes, information to reach out. So we'll see you on the other side and hope you enjoy.
Catch you on the flip side.
Hit my mic.
Now the mic's out of place.
Okay. We don't just highlight organizations or businesses. We want to highlight the people behind the impact, the ones giving their time both here at home and around the world. Today, we're joined by someone doing exactly that. Jan, a local pharmacist here in Dartmouth, a member of the Rotary Club Dartmouth, and someone who's just returned from her 5th medical mission with the CACHA. Jan, really glad to have you with us today. Can you get us a little bit more background, introduction on yourself?
Sure. I am a pharmacist here in Dartmouth. I've been a pharmacist for 25 years. I started with CACHA, so the Canada Africa Community Health Alliance, in 2019. I went on my first medical mission to Tanzania, and I fell in love with it. Wasn't able to go back until 2022 due to COVID. So I've been on 5 medical missions since then. And I just led my first medical mission, co-led with a partner in February of this year. So just have been back about a month.
That's
wow.
awesome. Yeah.
That's amazing.
Yeah, it's great. And toss in as well. When did you start in with Rotary?
Sorry, that's really faint. I can barely hear you.
Oh, great.
Jim just asked if when you joined Rotary and what got you involved with that.
I joined Rotary in 2022. And so on my first medical mission, I had met a bunch of Rotarians, mostly from Ontario, that had been volunteering with CACHA for quite a few years and had been able to support the communities that they had worked in from Canada through the Rotary clubs, through various projects, including things like drilling wells in communities that didn't have safe water sources. And so I really thought it would be a good opportunity to be able to continue the work. And so I started looking into Rotary clubs here at home. And when I contacted the Dartmouth Club, they were so eager to have me. And they had several members who had also done some healthcare projects in African countries. And so it seemed like a really good fit.
Nice.
Yeah, like it. Like volunteering.
Why volunteer?
Well, you like volunteering. How long have you been involved in volunteering, just in general?
I guess 2019 would have been my first big, volunteer venture. I also volunteer for just a small local community garden. So I sit on the board of directors for a community garden here in Dartmouth, and I am the head gardener, which sounds like a lofty title, but
something I would
really
love to
much.
do. I'd be right up there for that.
So yeah, I mean, I don't think I got very involved in volunteering until sort of recently, I guess, the last maybe 6 or 7 years.
Yes.
So what type, can you explain to us what a typical mission looks like? Is it from triage to the pharmacy care?
So CACHA runs mostly medical missions, but they also participate in infrastructure missions. And so I've not done an infrastructure mission, but they will go and either fix up an existing structure or build a new structure onto an existing structure, such as adding a new ward onto a hospital or those types of things. And so most of their missions are medical missions. And so we have typically a team of nurses, doctors, maybe nurse practitioners, sometimes people like paramedics, pharmacists, and then lots of logistics people who do everything from, helping to set up the stations and helping to get people organized in line and give out charts and take blood pressure and temperature and all those types of things. So we set up typically in a new location, either every day or every couple of days. Sometimes we'll do 2 or 3 days in a location, depending on the need. And so we will arrive in the morning and set up stations so that, first of all, we're putting up tents and tarps to keep people out of the sun and out of the rain. And then we are giving everyone a chart and asking them their sort of chief complaint. And so we have different practitioners that they can see. So usually we'll have a dentist, we'll have an eye doctor or ophthalmologist, sometimes an optometrist, depending on who's available for the mission. We have, of course, a regular medical station and then a gynae station, so any gynecological needs. And then we'll also have testing. So we can do certain tests, certainly not all blood tests, but we do urine samples as well as blood tests. So we can test for things like urinary tract infections. Yeah. Of course, we do a lot of HIV testing. We do syphilis testing. And then we can test for certain diseases that are common there. So one of them is called brucellosis, which is not something that we really see here, but we are able to test for it there, which can come from the animals that people tend. So their cattle and their goats and things, they can get this bacterial infection from. So people will go through all of those stations and see the practitioners that they need to see, and then they'll come down to us at pharmacy, and we will be able to prescribe and dispense the medication. So typically on missions, the pharmacists do the prescribing and the dispensing, because we are able to control our medication supply a lot better. And then off they go back to their home, and hopefully cured of whatever is ailing them. But also we have the ability to send them for referrals. And sometimes we have money at the end of mission to actually help them with a referral to see a specialist or to get a surgery or those types of things.
Sounds like very long days.
It sounds like really long days. A lot of medical people involved as well. Just wondering, like, volunteers with no medical background. Can people jump in on that?
Definitely. Yeah. The logistics team is very, very important. And so absolutely no medical background required. And, we have people volunteering for the logistics team that are sometimes, 19, 20 years old, people who are, in their 60s, 70s, and 80s. Literally, we have had all age ranges. And so, of course, some of it is physical work where you have to set up tents and tarps and things, but a lot of it doesn't require any particular physical strength and just requires, somebody to be interested, somebody to be patient. I think that's one of the biggest qualities that we need in volunteers, is somebody who's willing to just sort of take the time to do whatever is required. And sometimes things take a lot longer than we expected, or sometimes we have to change the plan, midway through and come up with a new plan. And so it does require a big ability to adapt and to be patient, and then just to be kind and, share your gifts, whatever they may be.
Right.
Love
That's
that.
amazing.
Yeah.
Yeah.
Yeah, that's great. Most recent mission, you just finished sending the Rotary clubs. Kind of your success. Do you want to share that with us?
Okay, so that was a Rotary project, and so that was from September of 2025, and so it was born of information from my CACHA missions that the eye doctor who comes on mission with us is a local Tanzanian ophthalmologist, and he had been collecting a list of people who required cataract surgery in the district that we had been serving, and so at one point the list was up to about 100 people, and then of course some people are able to get the money and go get the surgeries themselves, and some people of course have passed away or have moved out of the area. Anyhow, we were able to raise money through Rotary clubs here in District 7815, so that's the Atlantic provinces mainly. Anyhow, we raised $8,000, and we were able to do, we had first projected to do 20 cataract surgeries. We actually succeeded in doing 26 cataract surgeries. Yeah, it was very successful. We learned a lot. The first phase of the project, we actually brought 2 ophthalmologists and an ophthalmic nurse to the village of Tarat, which is a very rural location. And they don't have an operating theater. And so we set up an operating theater there. And we only were able to complete 10 surgeries there, although we had hoped to do all of the surgeries there. There were some challenges for sure. Setting up and maintaining a sterile environment in the middle of Maasai land in the dry season was a huge challenge.
I bet.
Anyhow, so the second phase of the surgery, we actually decided that we would take the remaining patients and drive them to the city of Arusha, which is only about 85 kilometers north. It's a bit of a trek because it is all dirt roads, and sometimes the roads are difficult, but we had 4-wheel drive Jeeps, and so that actually was more successful to drive the patients to an actual eye clinic and have the surgeries performed there. It actually ended up to be less expensive and a better patient care experience. So we definitely learned a lot, and really hoping to expand on that project this year and to be able to provide surgeries other than just cataract surgery. We will certainly continue to do cataract surgeries, but there are lots of people who need other eye conditions treated as well.
So that was the first of that project of that size then for you guys?
Yeah. So my Rotary Club has partnered with a Rotary Club in Arusha, Tanzania, called the Injiro Arusha Club. And so it was actually the club members from Injiro Arusha that had suggested this project. And so we were able to raise the money, and luckily I was able to go and participate in the project. But the nice thing is that we really do have a Rotary Club there on the ground who are able to organize, come up with ideas, as well as just facilitate, lots of the things that we do.
Well, yeah, definitely the local logistics are very much different than what you deal with here. So that help on the ground is massive for sure.
Absolutely. And just having people that are able to speak the language, people that are, able to make those local contacts and to know, where to procure all the goods that you need, and of course the local customs, and how to make people comfortable, because of course having surgery is a huge source of anxiety for so many people. So to be able to talk to people and explain what's going to happen, and what they can expect, and try to allay their fears, it's all very important.
Right.
Yeah. No. So biggest successes, what you have to have a couple like really uplifting moments for you while you've been doing any of your volunteering. I'd love to hear one.
The cataract surgery project was definitely, I felt a big success. There was a lot of learning along the way. There was certainly some small failures. I wouldn't say any big failures, but we definitely had to make adjustments. I think the biggest thing that I always take away from these missions is such a sense of camaraderie, such a wonderful experience of teamwork, that somehow this group of Canadians that all travels together become, like a family very, very quickly. And then this group of Tanzanians that we work with, usually there will be at least twice as many or 3 times as many Tanzanians as Canadians in the entire mission. So of course we work with lots and lots of local nurses and doctors and pharmacists when we can, although there's not a lot of local pharmacists to work with, and translators and logistics staff. And so to really make the connections with the local healthcare workers and local partners, and then of course the patients too. But yeah, I always come home with lots of new friends, and just feeling like we've really created a strong team together that has supported one another and has faced all the challenges really in a positive and supportive way.
Right. So you mentioned, you're doing a lot of surgery and the medical care, but you've also mentioned you've done some infrastructure projects.
CACHA has. I have not.
Oh, okay. So that's kind of separate than when you guys. Okay. See how that goes.
CACHA will run those on an as-needed basis, and so people could be responsible for things. They don't actually require any building background in order to participate in those missions. So similar to the medical missions, that you could just be there painting a wall, or you could be shoveling sand for making bricks, or there's lots of people who can participate, but I have not personally done that.
So co-lead, what is next for you?
Great question. I don't know the answer fully. I am certainly working on another ophthalmic surgery project that I'm hoping to get a Rotary District grant, which I'll have to have the grant application in May. So I've been certainly making some contacts about, partnering with some organizations that are already doing eye care work in Eastern Africa. Um, I don't have plans for another medical mission yet. I'm sure I will
But
participate in another
you're
one, but
nowhere
I
near
just
done yet. You're
No.
nowhere near done.
no, definitely not.
So let's talk about that then. Like from the time of idea to getting your grants and actually getting foots on the ground in East Africa, how long does that take from idea to foots on the ground?
Yeah, it can be really fast and it can be really slow. As far as the ophthalmic surgery project, the idea had been proposed to me a couple of years before we were actually able to make it happen. But once we decided that it was time to make it happen, we were able to raise the funds within a few short months. And I would say that I really started asking for money in June or July of 2026, and I was in Tanzania in September, or sorry, 2025,
Yeah.
and I was in Tanzania in September doing the project. So that was really fast, and that's kind of unusual, but I had already planned to be there for doing some preliminary work for my mission, so this was able to be sort of added on. Missions typically take a full year in the planning, and so CACHA always tries to have a mission date set, for the following year, even while the current mission is happening. And so they're always looking for people to volunteer. And of course, it's a huge commitment for somebody to take at least 3 weeks off of their employment.
Right.
And each participant pays a mission fee of $3,500, plus they pay their own airfare and things like, shots, medications, all that stuff that you have to do ahead of time. So it's a huge financial commitment. And so, of course, people can't plan that in a few weeks or a few months. They really need at least, a year, sometimes even more than that, head start to plan.
Yeah. That's amazing.
Yeah, it's different to basically Rotary might have a fee. You pay your annual dues, but it's essentially doesn't charge you to do it. Like you don't spend anything to have all your volunteering. Like it takes that's a whole new level, like a different level of volunteering when you're
I thought I was a volunteer addict, but I don't. I mean, I do spend money on some of the things I volunteer for myself out of my own pocket. But I didn't. I mean, I kind of should have clued in that you do got to pay something to go do these. It's not just
it's not just
here's
pick you
a free
up,
trip
get out of here.
East Africa, but you got to do this, this, and this. I don't know. I never even really thought of that. That's pretty interesting.
It's a huge financial commitment, and it's not everyone that can afford to do that. Even for people who have a large desire to do it, to be able to afford to do it both in time and in money, is challenging.
Right.
The nice thing is that once you decide to do it, then each participant is able to put their profile up on the CACHA website, and then put that out to all their friends and family, coworkers, whomever. And so people can contribute to your specific mission costs.
So another fundraising style type thing.
Exactly. And so like the very first time I went, of course, I had a huge amount of support because, people are excited for you and people want to contribute. And I think I had almost my full mission fees and travel costs paid for that very first time. Now, of course, I fundraise a lot less because I've done this so many times that you hate to keep asking people. Of course, I always have some key people who consistently contribute to my missions because, they love me and they love the work that I do.
And in some ways, isn't that like the person contributing? It's like, I can't go, but if I can help somebody go, else, then I feel like I'm helping.
Yeah, it's another way to contribute.
Absolutely.
Yeah.
Absolutely. One of my sisters said that to me recently when, she gave me money again to go. And she said, I'm doing this through you because I can't do it currently. And so, it feels different when you have a bit of skin in the game,
Yeah.
Do you have anything else there you wanted to close things up?
I just honestly, when you got into the whole pharmacy game, nice community person, getting into our community, just living here, did you ever expect that this is where, like, was this a plan, like, to go further than just in your community, living, like actually taking it beyond?
I remember as a young pharmacist hearing of a few people in the community. One of them was a local dentist, and a couple of other, older pharmacists, when I was a young pharmacist, who had gone on various medical missions. And I remember thinking, I'm going to do that one day.
That's
And I
awesome.
had no real plan as to, when or how I would do it. But I did have an aunt when I was young. One of my aunts had done a ton of work in various countries, but she had spent 6 months at a time, different stints of time in Zambia, Malawi. She spent almost 2 years, I think, in Nigeria. So she was a huge influence on me. That she always came home with wonderful stories and pictures and artifacts. So I think I always had that positive image of traveling to Africa and of doing volunteer work there.
Yeah, that's great.
Yeah.
So yeah, you totally did. You knew as soon as you got in, it was like you were pretty much ready to go.
Yeah.
Do you have anything else you'd like to say to anybody who's looking to get involved in CACHA, Rotary?
Yeah, I was going to say, what would say, one or two things would you say to somebody thinking about getting involved in one of these projects today?
Of course, it is a huge commitment, but the rewards are
Priceless.
Huge. Yeah, I really thought I would be a one and done, and then once I got there, within the first few days, I was starting to say out loud, "Oh, the next time I come, I will do." And then I was like, what am I saying? I'm not coming again. But already, part of my brain had switched gears and knew I was coming back. And so I think it doesn't really matter your skill level or your educational background, that if you have an interest in it, you can participate. And I think that there's lots of ways to also just help out. That CACHA runs lots of ongoing projects. And so they really try to support the communities that they work in year round. And so we have things like the fund for widows, orphans, vulnerable children. We have funds for helping children to receive medical care, such as surgeries. And we have the care and treatment centers that we support that are treating patients with HIV and AIDS and tuberculosis. So there's lots of projects that really need just dollars, that they don't need people on the ground from Canada, that, that they have lots of Tanzanians that are able and willing to do the work. They just need the funds to be able to do the work. And so also, if you're interested in volunteering, Rotary is a fantastic organization. You can be as involved as you want to be. You can just participate in meetings and do some local fundraising and, participate in some local community events, but also it can take you around the world if you want it to. So
right.
Yeah.
Well, that's the
That's
thing.
awesome.
Rotary is worldwide.
It's community to the world, really.
Yeah.
It's pulling it all in one.
Exactly.
So www.cacha.ca, CACHA, Canada Africa Community Health Alliance, for people who want to check it out.
That's
Excellent.
awesome.
We'll make sure we'll put that in our show notes as well.
Yep.
So yeah, we'll wrap things up, Jan. So we really appreciate you taking the time to talk to us and share your stories with us today. It's a great reminder the community doesn't stop at our borders. It is something that we can carry with us wherever we go. For everyone listening, if this sparked something in you, or and you're looking to get involved, whether it's locally through our local Rotary clubs, because there's lots of different Rotary clubs in our areas, or supporting the work of CACHA for what they're doing around the world, reach out. We'll throw these information and some contact information in our show notes today. So again, thank you very much, Jan, and it was great seeing you and chatting with you today.
Yeah, it was awesome.
Thank you.
Great. Okay.
All right. Just hold on. Eric's got to do something here.
Yeah. All right. Today's episode is going to be brought to you by our special producer, Colin Alexander with Conduit Media. He doesn't always make us look good, but he makes us sound really, really good. So if you ever need podcasting services, video sources, or any type of media, definitely give Conduit Media a shout. Thank you again, and back to the show.
Yeah.
Eric's favorite thing.
All right, shoot it.
Yeah. So today's hot take, brought to you by yours truly. I didn't make it up, but I'm getting to be in the fun seat here while Eric's in the hot seat. Eric, most useful thing in the world, open houses. Are they a complete waste of time in 2026?
Yes and no, because it all depends on the perception or what side you're on. What I've always told my clients since I've gotten into this business is that an open house does not benefit the seller. And it's true because they always say that the facts show that less than 1% of homes actually sell because of the results of an open house. So on the selling side of things, you're getting kicked out of your house for, 2 to up to 4 hours at a time on a Saturday or a Sunday afternoon, and just so you can have your neighbors walk through your house. Because how many times have we sat in an open house and the door opens and like, oh, hi, I'm just the neighbor from down the road.
Yeah.
Oh,
Don't bother me.
Yeah.
I don't need your attention. I'm just here for snooping. Yeah.
The open houses, I personally have not sat in an open house in about 4.5 years as a
Now,
selling agent.
not the seller, but who does? Who are open houses really for in your mind, Eric? Who would you say?
So that's where I mentioned earlier that there are two sides to this. So, and I also tell all my clients this exact same thing too. The open house only benefits the realtor that is sitting in that open house. Because if they actually do have people come in, they can have potentially pick up clientele. Again, less than 1% of homes sell because of the results of an open house. In my past, I've been doing this since 2007. I've picked up more clients from open houses, and I've gone off, and guess what? We always buy something else. We never buy the house that we actually met at the open house. So, like I said, it's been over 4.5 years since I've personally sat in an open house. And the ones I've done prior to that, you get the looky lures, or you sit there for 2 hours by yourself, and then you have to call your clients and say, oh, it didn't go so well. I sat here by myself, I had helped myself to the cookies you left, and this and that. I tidied up a little bit for you, but really, yeah. And then the clients say, oh, can you come back next weekend and do another one? And yep, sure.
With the cookies. So remember, if you're ever having an agent put on an open house, please make sure there are cookies.
But no, that's the thing. I mean, with technology now, like 99% of listings have floor plans included. They have virtual tours. They have the 3D dollhouse stuff. The Matterports and stuff. Like,
Yeah.
nobody needs to go in. It's not 1985 where you actually had the drive to see a for sale sign. Everything is online. We don't need to sit and waste people's time in an open house and kicking our clients out of the house for 2 to 4 hours at a time. To actually just, like I said, it's for that realtor to pick up clientele for themselves. That's mine. I disagree with open houses, and I have for a very, very long time.
Yeah, I'm definitely on board with that.
And we'll even say, like,
I know a lot
this
of
is
people
about as
who,
useful as a rubber chicken.
I like it. I'll again, come at them. Seriously, come at them. I want to see some different takes on that.
Yeah, I would love to too. Like I said, any experienced realtor knows an open house is really for the realtor sitting in that house, not the seller. Sorry, guys.
Nice.
And welcome back. We hope you enjoyed our talk with Jan. It was definitely an eye-opener. There was definitely information that I wasn't aware of. I know I kind of touched at the beginning of the episode, but you know, the big takeaway. What was your big takeaways on that? Like,
To be honest, it's I like the fact that, like we said, we're not just like trying to highlight just community businesses. Like, this is a community member.
yes,
Who has a life, has stuff going on in here, like locally, and still finds time both to volunteer locally and take it abroad.
Yeah.
I think these are the type of people that, they stand out in our community, and I feel like they're like the kind of unsung, like heroes, really.
Yeah.
And to me, it's really important that we bring them up.
I found it really interesting. You know, like you said, her community involvement from Rotary, which is very local. 'Cause, you know, there's the Rotarians go into schools and read and do all that local stuff, but that they can branch out worldwide.
Yeah.
Because Rotary is everywhere.
It is, yeah.
And they can do these things for these, communities that are underachieved and are underachieving, and the fundraising aspect too is huge. I know we get bombarded ourselves with our roles as realtors sometimes. I can imagine, like she mentioned, at first she was bombarding everybody, but then as the fourth mission and the fifth mission,
you feel bad
she's
going
like, I
at
don't want to
people.
reach out to all these people. But I think it's pretty easy to go out to companies and businesses and members of the other Rotary community to say, look, this is what we're doing to help these people over in East Africa. She was $8,000 or something. They said she raised.
Yeah. Like that,
that's not much, really. When you look at it, cataract surgeries and everything else they do.
And the fact that much money can go so far, I think is the big miss on a lot of people. Is it's like, what can I do? I don't have a lot to give. It's like,
I was
you don't
tens
always
of thousands of dollars for something like this, and you're doing these surgeries and then the medication and everything. But I mean, there was the other funds coming from the members, the volunteer members, because they had to pay as well to go over to
and also
do the
grants
volunteer.
and stuff like that.
Exactly,
like it's all there.
Yeah, exactly. And we didn't go down that road, but she did mention that there's grants that she has to apply for here soon for her next mission.
Yeah.
So pretty interesting. We're definitely going to keep an eye on it, and we'll definitely keep in touch with Jan to hear about the next mission, and maybe after that we can bring her back on and talk more about that one.
Yeah, and just a quick touch on like what the whole, we keep saying Rotary, and she's involved. It's really, for those who don't know what Rotary is, it's just a group of people of all ages, all different walks of life, who just want to volunteer and help.
So why don't you, Jim? Your first-hand account. You're president currently.
I am coming president. Yeah,
you're becoming.
Okay. I will be the president of
the
my chapter soon.
So tell us a little bit more than what you're, because I know there's multiple Rotaries throughout the city, and you guys kind of do a lot of the similar things, but you don't want to step on toes and cross paths. You want to help your own local community. So what are some of the things your Rotary is doing right now?
A lot of it's the local reading, like you brought up, is going to schools that could use the help. We already know, if you look across Canada, literacy is a big issue. So we're just trying to introduce it into the elementary schools that could use it. There's highway cleanups. We recently helped with donations to Hope for Wildlife.
Yeah.
Like it's like when we do the reads for set, like we'll go and we'll read the books and we leave the books behind in the classroom that we read. So they go to the library and to the teachers. Just elementary school.
Just
so
elementary,
it's right now that's it. It's you start at the bottom and
They'll
hopefully
go
by the time they get to the top, it's the other services of kind of come and play.
Yeah.
But also just volunteer with stuff like when Ribfest comes to town.
Mm-hmm.
They reach out and it's like, hey, do you guys want to take some hours working the gate?
Right.
Me at the last one, I was sweeping the rain because it was starting to flood all the stalls. It's just like we go where we're needed.
Yeah.
And all these people who get us to volunteer offer in some money for it.
Right.
And then we take the sponsorship, like the funds that we get, the donations, and we put it towards like our local stuff like Metro Care and Share and like the food bank and stuff like that. So
no, that's amazing.
Yeah.
So, all Rotaries is very similar to CACHA, and it's, medical or non-medical volunteers. Everybody reaches or digs deep and helps out wherever needed, right?
Yep.
Like you said, you're sweeping rain, and then these people are over in East Africa and they're making bricks out of sand. So
right.
it's pretty interesting.
It's all it's a different walk of life, but it is just showing that there are places people can go for the next step, for the help, for education. It's basically what we're doing anyway, just at a different level.
Yeah.
Yep.
Anyway. All right, so we really hope you enjoyed our episode today. Thank you again to Jan Rose, local pharmacist, Rotarian, and mission co-lead for her last mission on with CACHA.
Yep.
So we will make sure we put some information for CACHA in our show notes. Please make sure you like, subscribe, follow us on everywhere. We do the full video podcast on our YouTube channels, and we do the audio-only version across all major podcast platforms.
Podcast platforms. That thing.
Told you I was tongue-tied today.
Yeah, it happens.
I've been tongue-tied lately for some reason. But anyways, don't forget to like and follow and share. So again, my name is Eric Holman.
I'm Jim Smartin.
And this is the Community Game Plan. Thanks again, and see you on the next time. Da-da.